delighted to be able to welcome Andrew Hudson. Welcome, CEO of the Centre for Policy Development. Hand it over to you.
Great, thank you. Wonderful. Oh, I'll take that, definitely. Great to be here, thank you. We've got a fantastic session here, panel now, on whole of government policy, whole of government approaches. Now, I don't know about you, but I reckon every conversation I have, the answer is we just need a whole of government approach to this. We need to break down silos. If only government could work together better. We're going to solve that in this session, I'm pleased to say. And so what we really want to do is we want to provide some examples. We've got three fantastic speakers here who are going to give some examples from their life of where whole of government approaches have worked. And sort of we really want to draw out some lessons from those experiences and really demonstrate how those specific whole of government approaches are beneficial and provide beneficial outcomes. And perhaps we can also get into sort of describing how we can to avoid the barriers to whole of government approaches. And so this, of course, is a key part of wellbeing government. A lot of the things that we heard Lorenzo talk about and Jackie earlier. If we can nail whole of government approaches, we can really achieve a lot of those things. So that's the kind of the purpose of the session. So my name's Andrew Hudson. I'm the CEO of the Centre for Policy Development. We're a policy institute. We have a fairly impressive team here. If you work at CPD, can you put your hand up? Go on. There you go. So we've got a big team. They all work on wellbeing in one way or another. We've got a really big focus area. It's a big focus of our work in trying to achieve a lot of the things that Lorenzo was talking about. How can we really ensure that Australia, both at a federal level and throughout our jurisdictions and at a local level, we can really try and move towards a wellbeing approach. We work on many other issues as well. But to the session at hand, Angela Jackson is the Social Policy Commissioner at the Productivity Commission, which, as we all know, is a really fantastic independent institution, world-leading in many respects. She's also the National Chair of the Women in Economics Network and an adjunct associate professor at the University of Tasmania. She's also worked at the Department of Prime Minister and Cabinet, advised Finance Minister, and other political positions, and before her current position was at Impact Economics. So lots of really varied experiences. We were paying out on economists before, so I'm sorry Angela is an economist. When we have Matt Donoghue here, and Matt is also an economist. But Matt is the director of the Early Intervention and Investment Framework. And really one of the founders of that framework, and has been at the Department of Treasury and Finance in Victoria for 6 years, and a really fantastic, I think, advocate of wellbeing and what wellbeing can look like in government. I won't say anything more because I'll cannibalise what you're going to say. And then we have Kinga, who is an engineer, and so like me, not an economist, so that's good. I love Kinga's summary on LinkedIn. Started as an engineer, transitioned into finance and banking, jumped into politics, led a political party, and realised that these are just the best grounds for mindful training for a happy and contented life. So that's a pretty good bio, Kinga. But Kinga's been in public service for 23 years in Bhutan. He's the founder of the Institute of Happiness. So it's a fantastic panel. So let's get into it. So Angela, the Productivity Commission's been doing some fantastic work. The 5 Pillars Inquiry, if you haven't seen it, definitely check it out. I know a lot of people in the room have been engaging with you, especially around prevention. Do you want to talk to us a little bit about some of that work, or other examples you want to touch on, and how you've promoted a whole of government approach?
Look, thank you very much, and it's lovely to be an economist in a room talking about wellbeing, because I would, put forward that economists are very much interested, obviously, in wellbeing and maximising welfare more broadly. So it is a space where we feel very comfortable. Thank you, Andrew. So in terms of the Productivity Commission and the work that we've been doing, I think I'll draw on maybe two examples in terms of whole of government approaches. We've obviously got a proposal out there that's really looking in the prevention space at breaking down some of those silos. So our job was to look at how do we lift productivity in the care sector more broadly, and we've got a number of proposals to do that. When we think about productivity, it's obviously a word that is often associated with, GDP per hour of work. We're very careful in terms of saying, actually, in the care sector, we need to think more broadly, and we need to think about the quality of care and those broader impacts when we're thinking about productivity in the care sector. And we know we've done work last year around this in the health sector, where that traditional measure of productivity, it looks pretty poor at 0.1% a year, below even the very lacklustre broader productivity growth. When you take into account quality and outcomes that actually matter to people, like life expectancy, like their health outcomes, it's actually been growing at around 3% a year. And so you can see that quality is actually very important. But how do we lift that the quality of life, if you like, for the Australian population with the care dollars that we are spending at the moment? And one of the things that we really focused on was the issue around prevention and how we spend money in Australia. We tend to spend it on the problem rather than on stopping the problem or preventing the problem. So rather than providing people with those early interventions to avoid homelessness, we tend to spend the money down the track on those increased health costs or justice costs or wherever they pop up, rather than focusing on that early investment and that early intervention. And there's a number of reasons for that, and what we tried to do is look at, well, why is that the case, and how can we set the system up so that we see greater investment in prevention that ultimately leads to better productivity, so we're getting better outcomes for what we're spending, improves the overall welfare and wellbeing of the Australian population. And some of the things we identified to that was this whole of government approach, that the current system, the current budget system is very siloed. So, an individual department puts forward a proposal, this is the budgetary impact of this over the next 3 years on my department, and that's kind of it. Within levels of government and across levels of government, we don't have a very long-term view and we don't have a whole of government view. And so what we've put forward is a new framework for investing in prevention, that would provide that whole of government view, that would look at the benefits across all levels of government and across those silos, that would look at the impacts on wellbeing over time, the quantification of that, which again economists do every single day, day in, day out. We think about the long-term impacts on broader measures than just GDP in many of our models and many of our approaches, so that we can have an evidence-based future investment in prevention and really fits into the current budget system, but ensures that we can break down those silos. Now, it's one step. I think that infrastructure is important. Agreeing what we're trying to measure and what we're trying to achieve is important, and having that sort of central focus and leverage, I think, is also important. I'm now going to flip to what doesn't work, because I think the whole of government idea is often bandied about, and I did also, previous life, was involved in the COVID-19 inquiry into the Australian government's response. Now, that was an example where a crisis brought people together, and you saw a whole of government approach. People were working together, and there are models where, even today, with the National Coordinating Mechanism, where people can identify a problem and everyone comes together and they solve it in a crisis. Now, we can't live in constant crisis, right? So you can't sort of constantly invent, and we could say that and we often try and do this, of course. We say that there's a housing crisis or there's a this crisis to try and get people motivated to work together. But we really need our systems to be doing that. We've just also completed the mental health inquiry. It was the first inquiry I completed at the Productivity Commission in my role. There, the intent was this whole of government approach. They got the treasurers to sign it. Everybody signed up. We're going to have a whole of government approach to mental health and wellbeing and suicide prevention in Australia. Failed miserably in terms of actual implementation. There was a lack of accountability, a lack of governance, a lack of central leadership. And so we've made a number of recommendations about, well, what do you actually need to do to get that whole of government response? It's one thing to say it. You do need to make sure your systems and your governance are in place. And so I think that's partly those lessons as well that help inform this prevention investment framework, where it's not enough to just to agree that yes, we all need to work together. You do need to have the, both the infrastructure in place that allows people to work together and the accountability and the governance over that to be working. Otherwise, we won't get the benefits that are very clear. And I think all of us that are involved within government, you kind of, end up, your head sort of explodes at the lack of the working together across levels of government and across different silos, even within, the federal bureaucracy. And I went over time, didn't I?
No, you're perfect. Brilliant. Thank you. Yeah, fantastic. Thanks. I think that point around crisis, COVID-19 really did bring out whole of government approach. But as you say, we don't want to be in constant crisis mode. How do we make that a systemic approach? It's really powerful. Thank you. People in the room, feel free to use, people online, definitely please use Slido. We're starting already, we're going to have lots of time for questions. People in the room, you can use Slido if you want. We're also going to try and actually get some old-fashioned questions in the room as well. So get ready. Kinga, might come to you. The Bhutanese constitution explicitly promotes a whole of government approach. We'd love to hear from you a bit more about that.
Thank you, Andrew. Can I have the slide? Maybe just briefly, yeah. Okay. Thank you to be part of this wonderful panel, and then also thank you to UC and Professor Jackie and the whole organizing team for getting me all the way from Bhutan. Yeah, a lot of people are concerned about, how do we apply for a visa? So I really appreciate the humor that our Australian friends have. So the first thing they told me is, nowadays you don't need to be a convict anymore. So, so here I am. So I said, I'll pass that. But yeah, so in Bhutan, I think, some of you have heard about the gross national happiness. I think something that has gone global, a lot of, I think, attention. And our government has been doing quite a lot on that. And currently, I'm here with the Institute of Happiness, which is a private sector-led, I would say, think and do tank, which is something we founded after a group of us, alumni friends from the Harvard Kennedy School and then also the Divinity School. So I was partly in the Divinity School. I didn't quite finish that degree yet. So on the whole of government approach, from our institute, our sort of proposal is that what do you call the constitutional approach of the gross national happiness. And by that, what I mean is, if I can go down to maybe, yeah, so this is the one. So, I mean, when our fourth king, who, by the way, this year will be celebrating the 70th birthday, so His Majesty the fourth king has been the real person behind this whole theory of gross national happiness when he was just 16 to 17 years old, just a teenager. So we have come a long way. So especially for us, I think it's a special moment this year that the gross national happiness has come this far. And he is the one who gifted us of the democracy, drafted the constitution for Bhutan back in 2008. So me as a member of parliament, when I joined politics, through my experience, something that we have been trying to summarize at the Institute of Happiness is the constitutional equation of GNH. With this, I feel that it is a government, whole of government approach. Not only that, but is a constitutional provision. So please don't mind all the access and all the articles out there. But it does denote three very important provisions which is not available, at least through our research, in any other constitution. So one is X is greater than 60%. So this is, I know because of the time constraint, otherwise I would be interacting and say, who can guess what X is? But that is the environment. Constitution of Bhutan says, Article 5, Section 3, environment has to be 60% at any given point in time. And right now we are at 75%, not doing bad. So that is the environmental domain. And one would say also the scientific and the Newtonian domain, because all the four elements of water, air, earth, and fire is there. The one on the y-axis is actually called y is less than 65, again, is because even at the age of, when you reach an age of 65, even His Majesty the King has to retire. So that is a constitutional provision of Article 2, Section 6. So again, in terms of the social domain, we have this very powerful and very specific, unambiguous constitutional provision. So which our institute, we feel that these are the constitutional provision in the environment domain, in the social domain, and I know the report that Jackie presented in the morning, very similar in terms of how we are gaining in the Newtonian domain, but we are losing in the social domain, right? And that's one of the things that has been, you know, I think a global trend, because we saw the same thing in Bhutan, which, by the way, I think day after tomorrow, I'll have another session in the measurement, and I'll be happy to talk about it. And so the ultimate, actually, effort is to come to Section 9, Article 9, Section 20, which defines the state of GNH. And interestingly enough, it's a state where it talks about emotion, nothing on social domain, nothing on Newtonian domain, actually. It says that you have to have 4 immeasurable qualities of compassion, love, equanimity, and joy. If you have these 4 context and conditions of your emotion, then probably you're in a good position to handle anything, whatever challenges that comes across your way. It might be time constraint, it might be bad traffic, it might be disaster, and we are talking a lot about the caregiver, you know, bad things happen to people, but all during these situations, we realize that that particular provision in the Article 9, Section 20 is the GNH domain. So all this, by the way, are actually, each one of these have 4 elements. The 4 elements of nature in the x-axis, the 4 stages of life in the y-axis, so the study, education life, the wealth creation life. So a lot of my Buddhist friends here, I tell them now, it's too old for you to study, you better make some money now. You know? And then finally, we have the 4 elements of, you know, immeasurable 4 elements, which I just talked about. And then we are also saying that, by the way, the guy behind this whole idea was the 4th king of Bhutan. So we are just sort of, you know, bringing out that element of the figure 4. So with that, I think this is something, again, unique, other than the one that we might find in the conventional and deep research studies. I'm not an academician, I'm a politician engineer, as you have said, and the only paper I think seriously published was the manifesto that we worked on during my last election campaign, and by the way, we didn't win, so I don't know whether that was a good sign or not. Thank you.
Thank you. Thank you, Kinga. Thanks so much. So fantastic example about, obviously, a constitution. I doubt we're going to be able to amend Australia's constitution in this regard, but I think it's really useful, though, to show the importance of having an instrument that can guide and really, across those domains that you talked about, really promote whole-of-government approaches. So Matt, you also have an instrument in Victoria, as we said, the Early Intervention Investment Framework. It'd be great to hear from you about how that promotes whole-of-government approaches.
Cool, thank you. Thank you for having me and our team for being here today. It's real honour to be on this panel as well. Wonderful. Noting the time commitment I'm working to, I'll speak for a minute about an overview of the framework and then speak a little bit more about some of the lessons we've learned and how we put them into practice. So firstly, the framework in Victoria has been around for now coming to its 6th year. It really seeks to lift the floor on evidence, to put a higher level of evidence in the budget process. It also seeks to take a look at the longer term in that budget decision making, looking at 10 years rather than the typical 4 or 1 year that sometimes is part of the budget process, with the ultimate goal of changing budget decision making through evidence and providing a scale-up pathway through evidence for proposals that work, with the ultimate sort of measure of success when more upstream proposals are funded and they work to provide early in need before people's needs or conditions grow more severe. So over that journey, there's, just to give a sense of scale, there's started with 5 social investments in Victoria. Before the framework was put in place, we're around 50 million worth of investment there. 6 years on, there's around 110 social investments in Victoria to around funding of 3.3 billion of funding, which is growth, but still very small relative to the base of acute funding, if we put that relativity in there. But scale isn't the measure of success, and I've said that. And funding isn't the measure of success. the question is, looking back at those programs that were funded, did they work? Not all have reported, but most have reported outcomes. And for those that are reporting outcomes, most are working, most are effective. And there are many examples of a scale-up pathway where a program has shown its effectiveness, then it's gotten bigger or continued or gone, even one instance going statewide. So I think, I might end on that for the framework, but if you have any questions, feel free to ask. A couple of things that we had to learn at the start of this framework were probably learnings about things that Treasury needed to do better. So if we look at a predecessor to the early intervention framework was the social impact bond work in Victoria. And one of the strengths of that is outcomes focused and putting people centred and breaking down the silos. So those are positives. One of the things is probably Treasury is responsible for one of the negatives is really focused early days on the finance, the financial outcome that was coming from these bonds. And I think we got that wrong. So if you look at the early intervention framework, it first has two criteria and it balances them 50-50. The first criteria is client outcomes, so we can track the effectiveness of programs for the clients over time. And the second is avoided cost or system impacts, which are the financial aspects, so we can track and book savings as well. So that was an area where I think we have to be humble. We need to change the approach, and where we have. The second area where Treasury is, I think, changed its approach to the framework is, I think we're pretty humbled that now that we don't have all the evidence, and I think it's fair to say no one has all the evidence. As Treasury, we're economists, we're accountants, we have that knowledge, but we didn't have the connection to how is this working at the operational level. So there's been a push for us for more evidence and more collaboration, more of an outward-focused Treasury. Also, in working with departments, there's always a tension between departments and all asking in the Treasury the common sort of way for money from a finite budget source. But we thought that there would be better evidence by us working and engaging early. So we built our own capability so that we could do more of this work, but also recognise that we need to help other departments build their capabilities. And that's been a transition over the last 5 years as well. And I think that outward-focused Treasury is definitely a change in mindset, but it has been at the core since the beginning of how it's been implemented as well. So I would recommend that for any similar approaches.
Brilliant, thank you. So a really concrete example of what one jurisdiction in Australia is doing. So that's brilliant. Thank you very much. I just wanted, and we will get to questions soon, so keep them rolling in online or in the room. I've already had a look at them. There's some juicy ones for you, Angela. Get ready. But I just wanted to start. Maybe we can just go around. And maybe we'll start with you, Angela, as well. What did you hear from kind of Matt and Kinga? Were there any lessons or key ingredients that kind of resonated with you?
Yeah, look, I think from Kinga, I think certainly that, and sorry, Kinga, you might not be aware, but constitutional change in Australia has been infamously difficult. And 2 years ago, anyway, I probably can't say, but almost a national tragedy, we had a referendum to recognise and provide a voice to our Indigenous people that wasn't successful. And so I think the concept of more constitutional change is probably off the agenda for a time, at least, unfortunately. But I think the approach really is that idea of setting a national agenda and, I guess, targets and the leadership that's needed. And I think for all its flaws, the government's Measuring What Matters does provide something towards that. It's just really, for me, I think, around then how do you operationalise that? What does it mean? At the moment, it's great that we are reporting on these measures. It's great that work's being developed, but it's not necessarily then flowing through to how government is making decisions. And I think for us as well at the Productivity Commission, we've been thinking a little bit around the way a national prevention investment framework could be an operationalisation, and sorry, I can't say the word, despite I got up too early this morning, of that, and that's really important. So that linking between, yes, you need objectives, but you also need a way of actually achieving those objectives. And I think, look, the EAF experience, that openness to learning, I think there is a sense at the moment that, as part of the national policy conversation, that greater investment in prevention is needed. We talk about silos all the time and fragmentation as part of our national federated system. This is an approach to start addressing that. It won't be perfect. There will be mistakes. There will be things that will need to be defunded. There are risks, but if we keep doing what we're doing, well, the costs just keep getting higher and higher. And you can't sort of sit back and go, oh, it's unsustainable, this increase in costs in the care sector, and we can't keep meeting the increasing demand which the population has for these services without actually going, well, how do we fix the system? And fixing the system is going to require continuous learning. So I think just hearing about that process was really, really worthwhile. Thank you.
Yeah, brilliant. Kinga, did you want to just pull out a couple of things that you heard from Matt and Angela that resonated?
Sure. So I think what I hear, Angela, especially in terms of, I think, since you're talking a lot of time, example on the caregivers and care systems. So basically, even in, I think, advanced governance system like Australia, from what I'm hearing is you're more reactive than preventing, actually, on the whole well-being, whole of government approach. And I just wanted to share that even though we have a, constitutional provision and we have a whole system set up in Bhutan, but practically, I think it's extremely difficult even in Bhutan. That's why, actually, if you look at the World Happiness Report, we are not on top. We have lost that out to the Scandinavian countries. And but this question I really have to put, you don't have to give the answer now. Guess where Bhutan is on the World Happiness Report when we used to participate? That was way back 2021. So anyway, you can tell me during the break. So I think so it's something very, very difficult, but at the same time, in a gathering like this, then this is where I think through the platform we can exchange and share a lot of ideas, because the multivariability is so big. And then the sort of the linear study that we do in the time scale, if you change anything, then you don't have the data set. So it can be extremely difficult. Even for Bhutan, we have been doing this for the last 20 years or so. On Matt's thing, I think some figures, of course. I just realized that when you said $3.5 billion, I think, from Treasury.
Just under, but yeah.
Yeah, so I was saying that's the GDP of Bhutan. So next time I just wanted to suggest that maybe if the impact is not visible here, then maybe you can divert it to Bhutan. But it's just mind-boggling. I think when you look at these numbers, the Australian GDP is 500 times the GDP of Bhutan. Per capita is 25 times the per capita income of Bhutan. So as Professor Jackie has presented, a lot of progress in material wealth, a lot of progress in well-being from that parameters. But I think when it comes to the social indices, then it's pretty much same again. So I think very interesting data to compare. And finally, I just wanted to say that I think in terms of some of the things that which probably I think now there is a growing trend on, it's not only I think the action and everything, but also I don't know whether government approach could be in terms of just raising awareness and education. I know Lorenzo was, right, correctly said, activist. If you can actually do that, then nothing like it. But even if not, even if passively, I think if the awareness could be raised, I think that can add a lot of value, because eventually we know that even individually we know that smoking is bad for your health, but we do it anyway, right? So I think it's the whole point on, again, using the tip of the iceberg analogy is that what you see, 10% is a lot of times my experience from the government and the parliament in Bhutan has been that as politicians, we always focus on the 10%. Yeah, let's get it done because that's what everybody can see, so I'll get my next vote, right? But I think we are just ignoring the 90% which is beneath the surface of the iceberg. Thank you.
Well, thank you. And I know Catherine and Lorenzo would tell us it's not all about GDP, Kinga, so let's not focus on the disparities. Anything you wanted to add, Matt?
I had a great answer until Kinga started speaking. I just but there's a more fundamental point. I think tracking helps us improve things over time. Like even tracking just to know where you are knows what improvement. And I think the verb you use, which I've said 200,000 times probably in the last 6 years, quantify. That's not the same as monetize, but that's a starting point where you can track, this is where we are. Where are we next year? And keeping that trend and relativity going through time is really important.
Yeah, great. So there's a couple of questions here on Slido that I'm going to sort of combine that are similar. But then after, I'd love for someone to ask a question in the room. So we'll try and get some energy in the room. Great. Okay, if we can get a mic over here to this lovely lady, and then you'll be waiting for a little bit. I'm sorry, but so there's sort of two questions here which go to the same point. So how can we reduce the evidence burden required to make wellbeing decisions in government? You can probably see that one over there, right? But there's another one that's kind of related. Well, these keep moving around. So if the Treasury can't get numeric evidence but believes something will work via theories of change or not, can it take a precautionary approach and invest anyway? So I guess a number of these questions, I think probably more aimed at Matt and Angela about, how can we try and get government to move forward with these wellbeing decisions?
I mean, Matt, you can speak to this in terms of the level of evidence required. I mean, it's an interesting question because I think, the evidence bar does need to be there, so that you do need to, I guess, you might not have it real world in Australia, but you do need, and the ability to say, well, we think by investing here, and it's always difficult without examples, if we invest in avoiding homelessness here, this program has been shown to avoid homelessness, then we know that, we will avoid this many homelessness episodes. We know that we can follow through the evidence line and therefore we can quantify the impacts. I think that is important that we have that evidence base, so it can't just be, and hopefully that's not my phone, I was very worried about that before, sorry, in terms of evidence flow through. So I think that we shouldn't be scared of evidence, I think is also, something to really hold on to. I think often we feel that in this space where we're looking at social change, that evidence is going to stop something happening. There is very strong evidence out there across a number of different programs in different areas that interventions work. And it's just about what is quantified and how, and then what's prioritised. So there can be, exceptionally strong evidence, for example, linking, people's how people are faring when they start school and how they then track through school and then how they do in life and what their long-term labour force, productivity impacts are. It's very, very strong. We've got very strong longitudinal evidence. It's just that isn't necessarily taken into account when people look at investments in early childhood education and care, because they're not looking over those timeframes. So I think it's important that we're not too worried or scared about that evidence burden. It's just about saying, well, what is it we're actually trying to achieve and over what time frame is what needs to change, rather than thinking, that we should back away or say, no, we don't need evidence. Evidence is actually our friend in terms of these investments often.
Yeah, I couldn't agree more in a lot of ways there. I think there's also recognition from a funding aspect that government, there's an idea of the idea that it works and has got lots of literature but hasn't got the numbers yet. It's not a one-off decision for government. It's potentially a pathway. So if evidence is low to begin with, government can make a decision to start tracking outcomes for it and validate that work at a small scale. And then if it's worked at a small scale, has a question to come back again for more testing at scale, whether it works, and then testing at different levels of scale over time. It's not a one-off event. So you can build the evidence, I think, as well. And that commitment to learning is part of these things. Not some solutions in some portfolio areas don't have much evidence, and there's a number of studies that say where the gaps are, and sometimes we need to actively build that evidence and try things. Other areas where there's strong literature, it's been validated, and it's more about questions around how much can be afforded and what will it, rather than what will it get. This is what it will get, and this is how much it costs. So there's a spectrum, and I think that's coming from the impact bond space, where everything is a really high level of evidence, to just the general budget in this framework. It's the full spectrum in budget, from things that have no evidence for the first time to programs that have been running for 10, 20 years have really good evidence. So being flexible to everyone's on a journey building the evidence, but building the evidence is good.
Brilliant, brilliant. Let's go for some energy in the room. So let's go to this woman here, and we might take two as well. So if someone, yeah, there we go. My friend from ANU over there, great.
Thanks very much. My name's Chelsea. I'm from the Planetary Health Equity Hothouse doing my PhD, which is focusing on Commonwealth Treasury and its ability to develop a wellbeing economy. So my question was for you, Matt. I was interested in just some of your hinted comments about Treasury in Victoria. I'm curious to know what you think the conditions are that would actually facilitate Treasury to change or shift what are oftentimes deeply entrenched norms about what success in an economy looks like.
We might just pause there. We're just going to squeeze in another question.
Hi, I'm Jo. I'm a research fellow from the ANU, and I wanted to pick up on the conversation around the fear of evidence. My question was sort of linked to that, but the cultural shift. I'd be really interested to hear more about your experiences of shifting culture, I guess in government, but this applies to non-government organisations as well, towards being willing to embrace de-siloing. And I guess part of that is also being willing to accept that evidence might show that what you're doing isn't working, and getting past the, oh, that's going to make us look bad, and shifting the mindset around, okay, well, let's use that to do better. So your experiences, I'm really interested in that.
Great. So if we can attack those two questions, who wants to dive in?
I'm happy to have a go. So I'm happy to start by defending my Treasury colleagues. I am part of the Treasury portfolio. I think Treasury in Canberra actually has done a lot of very good work in this space and has shown a lot of leadership in terms of its approach to the importance of equity and broader economic metrics. So I don't think we should worry too much about, Treasury itself culturally being non-fertile ground for this movement or for a national prevention investment framework and to operationalise a wellbeing economy. But it does mean new ways of doing things. But there are a lot of those skills within Treasury already, I would offer. And you see those from, in different pieces of work that Treasury has done over the years, certainly. The second question around the silos, I think, is something I do think about quite a lot, and certainly, as part of this Care Economy report, we've thought about a lot, and certainly thinking around, well, what is it? We've been doing some work around collaborative commissioning, for example, which goes exactly to this point, people coming together and sharing resources to get to a shared objective. I think it's complex, like the human behavioural side of it in terms of power and control. Like they're quite sort of innate, ingrained loss of control type issues that come to the fore. So you do, which is why I think it comes down to governance, the accountability, the leadership over the top. It has to be in people's self-interest to do this, and they have to feel that this is how they're going to be effectively rewarded or judged in how they do this. I think otherwise what you see is people find every excuse under the sun about why they can't do things that would clearly be in the broader interest if it involves them losing power and control. And that they are very difficult organisational barriers to get across, and so that national central leadership, and one of the reasons in the mental health review I was talking about before, we highlight the need for PM&C to really play a central role federally to break down some of those silos. I think you've seen Mark Butler, who's just created this massive new department exactly for that reason. He was trying to get reforms through, found the silos exhausting, couldn't get the change, and so just thought, oh no, I'll put them all into one department. This will solve the problem. Now, you can't do that across government, but it is that leadership and thinking around the accountability and what you really want to achieve, I think, is also important. Productivity Commission also looks at closing the gap. Similar issues, again, in that space where I think we haven't seen the change we really want to and what people have committed to, because, you know, where is the accountability that holds people to account for actually working together with others? It sounds very simple, but I think unless the system actually is geared towards it, you just don't see that system-wide change.
Okay, thanks. So just wanted to touch a little bit on the evidence and the culture part. So in Bhutan also we have done this survey at the national level every 5 years, and exhaustive survey. Actually, sampling is itself, we are talking about 11,000 households, so you're looking at probably more than 10% of the entire population. So that has been going on for the last 20 years. And we also, my personal experience has been a lot of limitations, actually, even with evidence. I know in a government setup, we do require that because, you know, we need to have our reports, we need to have the numbers. But the only thing is, even for a small country like Bhutan, where actually it is manageable compared to a huge country like Australia, a lot of limitations on evidence. So that's my one thing. And that, in a way, again, has to tie in with culture. Bhutan is fairly a homogeneous culture, so in the sense that, you know, things which have been going on for the last hundreds and thousands of years. So pretty much everybody is aware of that, and we can actually come on the same page, but still very difficult to break the silos, extremely difficult. So based on these evidence, government has set the baseline target for the 5-year plan, so where the budget has to be allocated locally at the remote area level. So remote area, they get 5% more than the urban centers in terms of budget allocation because they're less happier. Same again, you know, urban people are more happier than rural people. And the project screening tool also based on evidence. So we have 15-member committee who will look through the project, do they satisfy some of the major GNH indices requirement, and then accordingly the projects are approved. So even that with evidence-based policies, a lot of, I think, tweakings required, a lot of changes required. So I think this is where perhaps I think it's more difficult and challenging in Australia because obviously you have many different ethnic groups, many different regional groups, so they speak different languages maybe and come with different cultures. So it's quite difficult to do. But at the same time, I think that is where I think now where we are in some ways going back to break the silos, also going back to the, you know, good old psychological mindfulness training. So that is something now in Bhutan and even our institute, we are doing that. But that do require your skills. I have signed up in a very, very sort of secretive and interesting mindful training, which has been going on in Bhutan for thousands of years. But initially you do with habitual, you know, repeating and chanting it or whatever. But when you get it there, then it's all about training yourself to do nothing. I think we talked about it's very impossible for us to do nothing. But now I'm getting there, and I wish I could share with you, but secret.
Thank you. We've got 20 questions on Slido. No. So we're going to get to them all. No, we aren't. So I'm going to sort of prioritize, this is the power of the chair. I'm going to prioritize some which I think are really relevant to this session. And yeah, maybe we can take another question in the room as well at some stage as well. Hey, so there's a great question here for Matt and Angela. What is their appetite for an EIF-like framework at the federal level? So EIF being the early investment framework that Matt's been talking about. You guys want to address that? Is there appetite for that at the federal level?
It's your interim recommendation.
So that's sort of what we tried to do, but it is slightly different to the EIF. It works slightly differently. It's obviously sort of got that interjurisdictional lens on it as well and is a bit more focused. I guess the Commonwealth currently has sort of the Pharmaceutical Benefit Advisory Committee. It sort of has this approach of assessing evidence and outcomes and so applying that approach. So it's sort of more within, I guess, the ecosystem and the culture of the federal system. Is there an appetite? Look, can't speak out of turn. There's certainly interest. There's certainly probably more interest outside of government maybe than within, or enthusiasm. So anything we can do to sort of push it along. And look, we'll put our final report to government mid-December, and they'll table and respond to that. I think there's certainly an interest in how do we better make budget decisions with a longer term perspective, and in terms of, from the government's point of view, and I think there was a question there around how do we get more political interest in this space and in these investments. And ultimately, people are motivated. It is important, like in this room, obviously people are here for a reason, and we're, our focus is probably a little bit broader than maybe a lot of decision makers or people in positions of power, and it's important to think about, well, what's motivating them and their considerations, and so how do we, I guess, preface our arguments so that it fits within their thinking. And a lot of their concern is around long-term costs and the sustainability of the system. And I think the good thing around prevention and wellbeing is, well, I've got a solution for you. You're worried about how we're going to keep caring for all these people into old age. You're worried about these broader health costs. You're worried about how do I lift productivity? Well, by focusing on these wellbeing metrics through these programs that we know can work and these investments, I can solve some of your problems for you. So I think it's important for us to think about how other people see problems as well as how we might want to define them ourselves, because other people are thinking about these things, and people do ultimately, just one final point, everybody, I think, intrinsically wants to make Australia a better place in the future, right? That is what's motivating most people involved in public policy. It's just how people may conceptualise that might be different. So I think thinking around how we communicate what we're saying is important too.
Sure.
So there's also some really good questions practically about how we promote whole of government approaches in here. So I might sort of combine a couple of these. And Matt, I know you'll have some ideas on this. So there's one in here around the Australian public sector and how we can kind of reform it to be more poised for whole of government approaches. So, how portfolios are managed at the moment, which seems to deter whole of government approaches. And then there's another question here which is kind of related around, I can't see it. It always just moves this order when people vote. I've lost it. Anyway, let's talk about that. Oh yes, here we go. So a very practical suggestion. Could genuine ongoing hybrid teams across departments and internal teams, for example, finance and policy, help to build an authentic whole of government lens? So just some really practical suggestions there. It would be great to get your thoughts on that. Do you want to start, Matt?
Look, it does happen. So it just requires more coordination, usually joint sign-off processes. So for the budget every year, there are sometimes where ministers are joined up on brief and the teams work together and work out. I don't think it's a commonplace across the board. I think there's like a role for Treasury, and rather than being a blocker, which we sometimes get told as being both an enabler and a facilitator. I think one of the benefits of, when I talked before about building capability in Victoria, is that we built it from the centre and then wanted others to grow. But part of that gave us an opportunity to drive transparency too. So we said, we will help you with this economic modelling, but we are by default going to share it with all departments so they can check our homework. And that as a role modelling exercise got other departments, we can't, if Treasury is doing, we can't not share too. And there was this checking of each other's modelling, I think, just really important. And I guess that's on the estimate side, but then there's also the feedback loop at the end around, so we all estimated this, what was the real answer, and tracking that it's as expected or making adjustments. I think there was a really great question that didn't get to answer around what happens if something doesn't work. I think when you're looking at early intervention frameworks, you're seeking to address people that maybe experience some inequality or really tough circumstances and vulnerability. I don't think government wants to take money away from them, but I think government wants to put money well spent and make sure it's spending every dollar the best it can there. So just something well.
Yeah, brilliant. We might just go for a question from the floor here, if that's possible.
Thank you. A brilliant panel. Thank you. Sharon Friel from the ANU. Matt, you sort of made a comment in your remarks of that sort of spectrum of evidence. You're going from no evidence through. And I suppose I was just reflecting two things. One is the role of no evidence, but the role of qualitative evidence, because you also made the remark of having to quantify. And I do worry when we keep getting pushed to try to quantify things that it's just not fit for purpose, in a sense. So your reflection on the role of more qualitative approaches. And then how do we as a nation just build in when it's the right thing to do? If we're constantly trying to put a number on things, given the power of the budget in informing what we do, does this constant strive for quantifying, not monetizing, as you carefully pointed out, what does that do for the realms of our possibilities?
There were two great parts to the question, and I might take the first part and then hand on to a brave speaker to take the second part. I think there's acknowledged quantifying is a bit of an art as well, to make sure you're capturing the program logic and what effectiveness means, but also that it's ultimately trying to tell a story to government about effectiveness if something's working. And I think our process, so in government, we do this every year as an input to the budget decision making. We get data on how the outcomes that are being tracked, the quantified ones, are going from departments. Then Treasury writes a report, say, interpreting the data and then we give it back to departments, because there might be other factors, exogenous, qualitative factors that in the Treasury bubble we're not conscious of. So they get to provide factual comment, one, check that we've represented things accurately, but also provide further comment from context and qualitative information to supplement that, and then we provide it to government. And when our secretary signs it off and government's got a copy, then we give it to everyone in the public service, so they all have that information. So there is a bit of a loop in there to check that qualitative information is getting in there. It is a quantitative framework. I mentioned 200,000. It's that tracking progress, and I think that's sort of how we apply it. But acknowledge it is definitely of concern. And I think evaluations which complement the outcomes tracking have a real role in implementation learnings and how to do things better, and both are necessary in an optimal model. Yeah. So they probably capture more of those qualitative factors.
Thanks, Sarah. So I think this is actually something that, we have also been discussing in Bhutan in the policy domain as well, because of the silos and requirement of quantitative evidences. So one simple example is that we do have what you call the survey provides a recommendation to the government. And for example, the last survey provided about 105 recommendations which have been accepted, and then they get included in what they call the annual performance agreement with the various departments. So that's supposed to sort of tie them in together, but again, it's extremely difficult. But I just wanted to say one last thing is that sometimes we can combine them. For example, I don't know how many of you spend, how many hours you spend eating. So in Bhutan, the survey found out we spend about 4.5 years of our life eating. Not only that, the vocabulary of the cultural, so that's where the cultural component comes in. Vocabulary of Bhutan is centered around, if you're a family unit, we call it zatsang, which means eating together. And if you're with your friends, even if you're drinking, then it's called tosang, which means food together. So I think eventually it boils down to an element of trust. So even in Bhutan, to me, I think it makes sense to promote more eating together among bureaucrats rather than evidence, then go for some of these cultural values, I think, which are extremely important in terms of really, making decisions where well-being matters a lot.
Hey, look, we've hit time, unfortunately. I just wanted to give a shout out to a couple of questions. So Ben McAlpin, our most popular question, the reason I didn't read it out is I think we'll talk about it in other sessions around kind of how do we win the political battle. There was a great question about how is happiness defined in Bhutan. Please come and speak to Kinga in the break. I think he can't do that in a minute. And another really great question about how we can get measuring what matters to really prioritise whole of government processes and policies and many other great things. But look, thank you. I mean, there were so many great things to come out of this panel, I think. I mean, some quotes that I loved. Train yourself to do nothing. Geez, I really need to work on that. Evidence is our friend, and I think the important qualification that we need quantitative and qualitative evidence. The discussion around culture shift within the public service is obviously huge. And the importance of kind of national agenda and targets for promoting that wellbeing approach. But thank you. Please join me in thanking the panel. Thanks very much.